Very good morning to one and all present here. I, Dr. Kali Charan Modak, welcome you all to the day 3 of this AICT Training and Learning Academy sponsored 1 week faculty development program on entrepreneurship on wheel, navigating the mobile business landscape. So this is the first session of day 3, and my dear friends, today we are having with us Dr. Mayank Dubey sir. Sir is the co-founder and director of Quantech L2M Innovation Private Limited, holds a Master of Technology in Material Science and Technology from the National Institute of Technology, NIT Kurukshetra 2019, and a PhD in Electrical Engineering from the Indian Institute of Technology, Indore 2024. His research interests focus on SCAPs, TCAD, based modeling, and the fabrication of thin film calogramide based photovoltaic as well as the development of IoT enabled quantum monitoring devices for agricultural and point of care uric acid monitoring. Dr. Dubey has authored and co-authored over 15 research papers and hold 3 Indian patents. He co-founded Quantech L2M Innovations Private Limited with a mission to bridge the gap between academia and industry, aiming to translate lab-based research into market-ready solution, lab to market or L2M. In recognition of his contribution, Dr. Dubey was awarded the Madhya Pradesh Young Scientist Award in 2024. Additional accolades include the EO Global Student Entrepreneur Award, GSEA 2024 from the Entrepreneurs Organization and the Best Technology Award 2023 from IIT Indore. He has received several national and international fellowships, including the IIT Indore Short-Term Research Fellowship Program 2022-23 to visit Shinshu University, Japan in 2023. The Junior Research Fellowship under the DST-RUS Indo-Russian Joint Scheme and the Chanakya Fellowship from the Technology Innovation Hub from IoT and IOE at IIT Bombay 2023. Dr. Dubey has also been awarded the IEEE Nano Student Grant and IEEE Nano Travel Grant to present at 2024 IEEE Nano Conference in Gijón, Spain. In addition, Dr. Dubey is the founding chair and advisor of IEEE Nanotechnology Council student chapter at IIT Indore 2021 till present. Under his leadership, the chapter won the Darrell Chong Student Activity Award in September 2022 and the Best Chapter Award from IEEE Nanotechnology Council both in 2021 and 24. So on behalf of IPS Academy Indore and ATAL Academy, I welcome you, Dr. Mayank Dubey sir, to this faculty development program. So huge round of applause for sir. Thank you so much. Now I would like to call Dr. Jyoti Jaiswal ma'am for welcoming Dr. Mayank Dubey sir on stage. Please ma'am. This is all yours. Thank you so much.
And first of all, I would like to thank Professor Kalicharan Modak sir for inviting me to this talk. And my name is Mayank Dubey, and I am currently associated with Quantech L2M Innovations Private Limited as a co-founder and director. So basically, I will be interacting with you on the topic that is very close to our working culture and very close to what exactly the solutions we are providing to the society in return. So although you all are from, I think mostly you all are from the business and the financial side, so there will be a little bit technical talk as well. So I'm just declaring some kind of disclaimer to you. I will try to limit it as minimum as possible, but yeah, okay. So first of all, I would like to thank the AICTE Training, Learning and Academy sponsored 1 week faculty development program. And the program is being on the entrepreneurship of wheels, navigating the mobile and business landscape. So my topic would be AI and IoT enabled quantum biomedical sensors. This is an enterprise solution. We are that trying to fostering a sustainable and green development. So starting with our team, you can see this is our core team member, Professor Shabal Mukherjee from IIT Indore, Professor Pallavi Mukherjee from IPS Academy, you must have all known her. Dr. Chandrabhan Patel, he is currently at IIIT Bhopal. This is myself, Mr. Sumit Chaudhary, he is also at IIT Indore, a translation research fellow. Brahmat Mahapatra, Vikas is currently a CEO of our startup, and Ajit, who is a CFO currently at our startup. So basically we work on 3 different domains. One is gas sensing application, that is for the environmental monitoring and inspect. Second application is biosensor, that I will be basically discussing with you all the entire story, how we came around this thing, and a little bit of business side because I do belong from a technical background, but as a student I'm also learning the business aspect. So little bit things about this biosensor, and our one of the major product that we have in the market, that is agriculture sensor. So overall, in short, our story goes beyond this particular term you can see over here, L2M. Now what is L2M? L2M is basically nothing but lab to market. Now we are a technical domain and we are working as a researchers at IIT Indore. At that time we thought, like, although we are developing so much of technologies nowadays, but the focus of government and the focus of any particular institute should be on bringing those research back to society, back to the application of society. So whatever we are doing, we should be doing it with an objective. We should be doing it with an objective of at least helping of our society. So that is what the entire story goes around, that has been a lot of research into many IITs and NITs. These are all the institute of national importance. But how are they on the stage of delivering the technologies to the market? So that is the most crucial aspect, and with that particular thing in mind, we try to foster this particular thing, that is lab to market approach. And during that particular mindset, during that particular vision, we came across with several different things. For example, we can even help increasing the soil fertility. We can help in doing the water monitoring, that is the heavy metal ion detections in our water bodies, not just groundwater, even in the flowing rivers, canals, everywhere. So that things we have catered. Even in the environmental monitoring aspect, because we found although there are lots of business opportunities across all these domains, but we found there is still a big gap in what the technology and the current trends are providing, and what exactly is the requirement of the society at the end. So that gap we realize with the vision that we are, whatever the working is at the Indian Institute of Technology Indore, we wanted to deliver it to the societal application. So now, coming to this particular device, because entire story would be very complicated and very in detail, I will be more focusing on the healthcare aspect. In that particular aspect comes around a UA meter. This meter is a uric acid detection. So you can relate it, just going to our parents and grandparents. You can relate it with the insulin, that is the glucose, you can say the variation, the diabetic patients. So what was the procedure at that time? You must have remembered that our grandparents have to go to some particular lab test, and then this requires entire 1 day or 2 day, and then they have to take care whether they are getting the meal, before meal. So this is a hectic thing. And to get the report, it will take usually 1 week of period. So I remember my grandmother was having this diabetes, and we used to take her to those testing labs. And almost after a week, we used to get these reports. And now the most crucial thing is, a doctor cannot do assessment basis on just one report. That is the most crucial thing. For any analysis, for any detection of your exact issues, there has to be a collaboration of reports spanning around 1 to 2 weeks. That is up to the 15 days. What is your trend in the glucose level? Now, jumping back, coming today, all we have is a glucose meter in our hand. Just mostly you are having in your family, in your relatives, that glucose meter just a pinch, instant results within 20 to 30 seconds. So that was the change entire thing to the healthcare industry. Now the people can do the real-time analysis, because what was the defect into that particular methodology where people were going to the lab testing and then getting those results and everything, although it has been done today as well, but not for checking just basic 1 or 2 days. That is now for an entire week of duration, long term, because there is two things that we need to understand. One is the actual value of your blood samples glucose level, and a trend that what is your blood glucose level is fluctuating. What these devices that you have right now are basically giving you the trend, because there is still a debate over their accuracy. The traditional method are still more accurate. That one we have to accept. But they are not giving the trends in the real time. So there is a lot of drawback onto that aspect. Now jumping to this story, instead of focusing on the glucose, we focused on the uric acid, because uric acid level in body is a different biomarker itself. Now why I'm talking about this particular biomarker is this uric acid is associated with our kidney ailments. Whatever the diseases you have, there is certain chances that this uric acid in your blood, in your urine, in your saliva is going to vary. Now, this particular drastic variation would be captured by this particular device. And this variation, basically, there is certain levels, like in your insulin as well. So what this particular device will do, it will basically classify into 3 different segments, that whatever the uric acid you are having. And remember, I already mentioned that this is not just a one-time testing. It is a long due process. Over the span of 1 week, you will be doing it every time as per the recommendation of the medical professionals. I will be disclosing more details in the later slides. So this will be picking up the trends. And the uric acid fluctuations in your body is very crucial, and in the future it's going to be a major aspect. Like nowadays you are having the glucose strip, glucose testing kit, you will be definitely going to have a uric acid testing strips in the future as well. So the product is basically focused on 6 different aspects. First thing, starting with the real-time updates. I already disclosed that this particular device will give you the results in 20 seconds only. So anytime you feel there is something wrong with you, or you are having some particular kind of situations, so this particular device will give you the entire results. Now, one more thing, the real-time updates will just not come to this particular screen or something, like the currently glucose monitor you are having right away. This is also IoT integrated, that is Internet of Things integrated. So this particular device will give you the update, as well as in your mobile screen you have a app where you will be getting this particular update as well. So these 2 aspects are integrated into this one real-time update via mobile. Second thing is integrated alert system. Now what is this integrated alert system is, if you are checking your uric acid levels many times, couple of times, and it was drastically degrading or enhancing entirely, basically varying from its normal range. So this have an inbuilt alert system which will notify you that now this is the time, go to doctor, consult, get a proper treatment, or even there is a integrating protocol that we have integrated with this alert system, that if you choose to, because there is a entire privacy thing, if you choose to, then only it will provide the same update to your doctor as well. So once you give that consent to the particular mobile application, then it will be basically alerting to you and automatically alerting to your family doctor or whosoever the contact you have given. So this is the most crucial aspect that we have integrated into this particular system. Because sometimes even with our blood glucose level, we realize we used to do this testing every time. Even I a couple of times do it. But we do find that, okay, 140 level, it's fine. 160 sometimes comes up. We don't go into that complexity that whether we need to, whether we consider it so seriously or not. But over a range, over a week testing, over a couple of time testings, if your device is realizing, if your device is smart enough to understand that, look, 3 weeks ago, his uric acid showed up. This week also, 2 times it shoot up. And again, it is shooting up. Now, you may not be realizing, you may not be feeling it, but your device is basically understanding that now is the time to go and have a proper checkup. It won't be doing, advising you any particular medicines, because we indeed integrated those aspects as well. But I will show you later. We have collaboration with All India Institute of Medical Science, AIMS Bhopal. So they, with lots of, we need to follow, because healthcare sector is a very difficult sector to break into. So there are lots of guidelines. So it won't be suggesting you any particular kind of medicines. It won't be suggesting you go to this particular kind of doctor. But whosoever you are looking into those kind of doctor, it will be alerting to them that this particular your patient is having this kind of variation of diseases. So that is the most important and crucial part of the alert system. On-site control is the one aspect that I've already mentioned, that we integrated it with, basically this particular technology has this facility. If in future the guidelines allow, then the entire treatment can be done on site. But this is something more towards the telemedicine aspect. You must be knowing that telemedicine is getting so much of, you can say, generosity from the people's point of view. But the government, they are not very much excited to that particular aspect. So it has that potential, right now not integrated. Now, the high precision and monitoring, this is the main concept, the main technical aspect that comes into this particular kind of device, is the how this sensing layer, because the complete product is basically based on the quantum technology. Now this quantum technology has a quantum sensing material that we have developed in the IIT Indore itself. And that particular thing we have realized after rigorous testing, I will show it to you as well, that this particular segment is giving a very high precision monitoring. Although we are still claiming that we are not exactly precising results we are giving it to you, definitely the traditional method, the long-term methods, because this particular uric acid test, if you go, sorry. Okay, sorry. So, thank you. So if you even go today to your health clinic and try to get this estimation done of your uric acid level in your body, and I will definitely recommend it to you all, because we may not realize it, it is very crucial biomarker present in our body. So if you go and try to monitor it, it will take you anyway between 2 days to 7 days of week period to just to get the results. So that is the most crucial aspect. And even in those labs, in what particular methodology, because there is a chlorofluorometric machine is there that almost cost around 1.2 to 1.3 CR. So that particular machine, whatever it is being utilizing over there, I don't know what path labs are doing, the local path labs over there. So that particular machine will give you the most accurate results, but whatever the other path labs are doing, there is still a debate over their precedent. So we have basically tested our particular product in comparison to with that technology, which is costing 1.2 to 1.3 CR. And the advanced sensor technology, I've already mentioned the quantum-based sensor technology that we are employing over here with a multiple test kits over here. So moving towards this basic idea that I have already given, that the biomarker, that is the thing that is being detected from your blood, serum, urine, and saliva. In 3 cases, you can see here. In these 3 cases, there is some range. We may not to be so much go into the data itself right now. But there is some range you can understand, just giving this particular aspect, that from some 3-point value to some 7.2 value, the device is showing a normal range. This is the medically accepted range. We have not defined it. So this is the normal range. Anything less than this particular value comes under the basically hypouricemia. And anything that is beyond this particular value comes under the hyperuricemia. Now, these two things we need to focus. Either you will be going to the hypo case or you will be going to the hyper case. Just same with the diabetes, same with the blood pressure thing. We all know that BP, low BP, high BP, low sugar, high sugar, same thing. Just the terminology is some medical words. We didn't do it. Now, these two things are associated with these two, all these issues. If you are going to the hyper, that is the high uric acid levels, all these problems are there in your body. Gout. I don't know, in Hindi it is called as Gathia rog. So in most old age people, and generalized what we feel from the data, almost like the cases of uric acid fluctuation, 75%, more than 75% cases are of the gout, mostly in the older age people. Then kidney ailment. Now this is kidney ailment is more to the younger age people if they have a higher increase of uric acid level. And again the arthricity, obesity, heavy, so all these things have been categorized. In case hypo, there are several other factors, that is diabetes mellitus, sclerosis, AIDS, all these things are associated with this hypouricemia. So that's why I'm suggesting that this biomarker is so crucial. You can understand all these things can be early detected in your body. So that is the, you can say, magical pill. That's why we've shown it some kind of here as well. So this is a kind of magical pill. You need to just get it, check it done, and you may realize that what is wrong with your, if there is anything wrong with your body. So now comes the, if I am like a startup, I must be pitching it to someone. I must be pitching it to the general public, I must be pitching it to the venture capitalist, I must be pitching it to the funding agencies. So every time the question arises, what new we are bringing to the table? Is that something which has not been thought of? Is that something that commercially not available? No. Everything is available. In this world, you just saying that we are the first, we are doing it alone, no. You are either telling lie or you are not aware enough to know your surroundings. So we are not bringing anything new out of sort of thing. And to be very truthful, the technology itself that we are discussing with you, that it is going to be future in your hands, in your pockets, in your bags, in your labs. This technology is 20 years old, 20 to 25 years old. And the working methodology and the working principle behind this technology of the quantum computation goes as far as 60 to 70 years. So we have those technologies 60 to 70 years back. But right now is the time. So always and always the startups, the business that goes into success, it's not about what they did new or what they did not new. It's always about the timing. So now, right now is the timing that these technologies that have been invented, that had been done so far back times. The quantum technology is not something is been developing in the year 2024. It has always been there. The basic concepts of principles behind the quantum technology goes as far as to 60 to 70 years back. So what we are bringing new to the particular device is the quantum sensors, which are basically the base of our point of care diagnostics. This point of care diagnostics is crucial because right away, the traditional methodology, you have to visit lab, they are not real time, it is time consuming and the more cost. So the rapid and accurate response and the point of care diagnostics, these two things are associated with the quantum sensor. Now in order to understand the entire novelty of this particular device, we need to understand what challenges are we are facing with the existing technologies, or what challenges we need to overcome in order to come to the novelty aspects. Initially, it started with the poor sensitivity. Now, this word sensitivity means that, for example, you have a value of your glucose or something maybe around 80. But your product, your device, your testing lab in your locality, they are giving you a report of, let's say, 110. So when it was 80, the device was giving, the test was giving 110. Now there is a drawback of this sensitivity, that how sensitivity is being understood, because in a blood, if you are going, giving your blood to the lab, whether that particular technology is sensing only your uric acid or it is sensing some other biomarker as well. Because in a body, there is not just one biomarker. You cannot go and say that, take my blood and just check uric acid only, don't check anything. It is entirely not possible. The blood itself has thousands of biomarkers. Many things. Creatinine is there, adenine is there. Even your insulin. Most of the, you can say the molecules, they affect your data reading. So that's why I'm talking about the sensitivity. Sensitivity towards your just uric acid. So we have, I may, if the time allows, I may show you what this sensitivity is more accurate. That's because that particular quantum sensing layer, how it is getting aligned with uric acid sensors, and then only uric acid has that ability to basically change the overall characteristics of that particular device, that a quantum device. And that quantum device variation is what we are recording it. So that is what I meant by the sensitivity. So the more, so that was, I was discussing, you cannot just test one particular biomarker out of your blood. Then there is a point of care diagnosis, which is not available, I already mentioned to you. The high cost, because already the traditional methodology, I already mentioned that cost of the system is so high, you cannot get it very easily done. So the high, even in some of the reports I have saw, the range of that one particular test vary from 5,000 rupees and goes as far as to 60,000. That just one test done. So at present, 5,000 least accurate, just random data, and 60,000 highly accurate. And that is what we compared it, because that particular technology was available to AIIMS Bhopal. So that is the high cost associated. And remember, I'm talking about just one test. And the accuracy and precision, so again, the same thing. The better the pure sensitivity, the better would be your accuracy and precision. So now comes to this IoT-enabled portable sensor. Already mentioned real-time remote monitoring. You have an exposure history. Like exposure history is nothing but a kind of Gantt chart you must have understand. This Gantt chart will provide you your trends over the days, over the months of your entire history. This will be readily available to you. You may download it in form of PDF, you may get it printed. And then there is also something called as cost reduction, low power operation, and sensor shelf life. These three things are the most critical one. Sensor shelf life, we may not realize it. Even our blood glucose strips, even our this blood glucose monitoring device that we are having right now, its sensor shelf life is nothing, not goes beyond 2 years or something. 2 years, after 2 years, it will start degrading. The quality, maybe your blood glucose level right now would be 120. This device will give you result 116, more sort of accurate. But right now, after 2 years, same 120 result, it will fluctuate. Either it will give you 130 or it will give you 90. So that range variation would come because the device you are utilizing is degrading. So that is the most crucial thing for any particular product to understand its shelf life. So the device, so again, so the companies may claim that their device is having a 5 years of warranty, but 5 years of warranty of what? Just the electronic component, not their sensor, not their sensing layer. Their sensing layer will definitely degrade, and it will start degrading the day one you start utilizing your device. It will continuously degrade. There will be a sharp decline over the next 1.5 and 2 years. So their electronics may work, but not their sensing device. So that is the most crucial things of understanding the product that we are pitching to the market. Low power operation. Low power operation is again most critical thing, because we need to arrange, we need to look into such a product, such a device that won't be extracting a lot of power. Every time if you need to go and plug it to the 220 volt supply line, then it won't be so muchly readily available to you every time. You need to find some plug, you need to find somewhere particular places, and the device itself, because any particular device who is utilizing the AC 220 volt of power, it would be requiring additional circuit to convert it to the DC current, that is a 5 volt batteries and mobile that we are using. So there would be an entire transformer kind of device circuitry would be integrated into that particular thing. It would be definitely leading to your increasing the overall pricing of that particular device. So that is the most thing. And the quantum material that I am repeatedly focusing on, the best thing about that is it won't require lot of power to extract out. Just simple cells you use in our watches. This watch. These simple cells can be utilized and we can work upon that. So now I will be discussing some more thing about our background. I will be just trying to make you understand as close as possible. This will be an entire study how this quantum sensing layer was achieved. Now, before going to that, we have some kind of parameters, some kind of precursors. I'm not mentioning exactly what things are there. So, all these parameters, you can understand temperature, precursors. So all these things are associated with one particular system which is called as chemical vapor deposition. That CVD system is being employed to deposit that quantum material. And that particular quantum material that is being deposited has been controlled via different temperature, different precursors. So this is just an overall objectivity that we need to control. We need to have that controlling ability, because the quantum material is something of the you can say in a we are not even going nanometer scale, nanoscale. So we are going even beyond less than nanometer scales. So you need to understand that for that aspect, just getting some material fabrication in a bulk is a different scenario. You can go to some industry, you can do it. If there is some metal electrodes are there, you can go to some particular industry, they will make, they will mold, they will do something. For the bulk part, what will happen if I say you, our hairs are around 120, 110 micron, that is micrometer level. Our just one strength of hair thickness is about 100 micrometer. And I am going 10,000 times less than that. Not just one, that is 10,000 times the thickness of our hair, and we are decreasing even further in that. How to deposit such kind of things, how to fabricate such kind of material. For those things, there are some sophisticated instruments called as chemical vapor deposition system. We need to get it customized in India as well. This is the best thing. There is a company from IIT Kanpur. They have startup. They fabricated this particular system, which is called as Quasar Tech. You may search it. Those companies are working in India to fabricate such kind of system, which in foreign, this particular system cost anywhere between 80 lakhs to 1 crore in INR. And we are getting those fabricated in India at a dirt cheap cost of 20 lakhs. In 20 lakhs, we are going to achieve this chemical vapor deposition system. And in that particular system, we are optimizing all those parameters to ultimately get this quantum layer. So all these methodology I'm just showing over here, how we are getting into some kind of material, some kind of temperature strength, some kind of variations. And this is just a schematic. If you want, I can share with you the original image of the complete system. So this is this is a schematic of chemical vapor deposition system, which we'll be utilizing in order to realize a quantum material. So now, if you want to see how the quantum material look, which would be sensing this uric acid, it looks something like this. You see this scale is 20 micrometer. 20 micrometer, that is, you can compare. If I put one hair over here, it would be this large. Just a diameter of hair. That would be this large. And this particular sensing layer is this much. So that is what just idea behind this. So this is again same thing. This is 10 micrometer, and you know the thickness that I am talking about. It is 0.71 nanometer, not even the micro. The thickness of this particular quantum material is 0.71 nanometer. 1 nanometer is almost 1,000 times less than micrometer scale. So as I said, I am almost going 10,000 times less than our the follicle of our hair. So now, once we are get this particular quantum material, we'll be getting into this kind of IDEs. So this is our heart, this is our core heart. We need to focus on, because this is the quantum sensing device. So we worked on this almost, you can say 2 to 3 years before even going for the startup and everything. So R&D itself took almost our 3 years of research work. Forget about the infrastructure. Getting into R&D, you need the infrastructure. That would require you more than 5 to 10 years of work. So just R&D, I'm excluding the infrastructure work. I do have that, you can say, opportunity to not think about the infrastructure and everything, because Professor Shabal Mukherjee at IIT Indore, he was already working like for 14, 15 years of, to just get those infrastructure ready. So we just worked on the R&D aspect and realized this particular kind of quantum material. So now, once we got this particular kind of sensing material, which will be basically utilizing your uric acid to sense in order to get the results out of your glucose level, we fabricated. And this is just a prototype. So we tried, and this is very micro scales images. It may seem very large, but these are again very, you can say, millimeter scales of images are there. So we integrated it with some kind of devices, tested just to, this is just very scratch testing. Very, you can say, scratch work that we are doing. So the entire story that I'm covering and giving you an idea that how we started from very scratch work and where we are basically positioning ourselves today. So this particular device, which we, you can say, come from the chemical vapor deposition system, the quantum material made this device readily available to us. Now we integrated it with some electronics, because ultimately the person who will be going to utilize this particular device, they just want layman terms. There is nothing technical that need to be pitched to, need to be known to any general public things. So some electronic circuitry would be helpful in order to give a just brief idea that this is your level. Maybe we started with LED lights, green, red, blue, that's it. That green, okay. Blue, oh, shoot up. And red, okay, it's going down and something dangerous. So we integrated, then converted all these technology. There is not, I'm not showing very different results out of this. We, over the different, this is a different phase, this is a different phase. Now this entire research work was converted to a different kind of sensing technology, that is a USB port. A lot of time frame went under doing this, just this transition. Still, I'm just showing, just giving a just idea of our work. And then the development of entire circuitry of this particular product. And where you can see there is a USB port alignment over here, where you will be utilizing some kind of strips, which will be just entering through USB connection and particularly to this your product. And it will be basically giving you some idea. So now, once this product is ready, it will be giving you a real-time transfer to your mobile application. So a mobile-based application, that is Android and iOS, is also required. So this particular device is hosting itself a GPS, a GSM, a Bluetooth. All these modules are already integrated into the circuitry of this. I will show you a schematic if I have, I need to check it. So the entire circuitry upon this is working standalone. So you don't need to put extra things. Although if you want to give access of Wi-Fi to this device, you must be having that Wi-Fi modem available to you. But apart from that, the Bluetooth, the GSM, everything this particular device can handle or say no. And there is a mobile-based application. You can see the uric acid, glucose, caffeine. All these are different biomarkers. So this particular material, this particular device can detect all these. And if you go to the concentration level, this is the data value is for our understanding, not for the general public. For the general public, good, moderate. That's how we started. Just we utilize it, some LED lights initially, transitioning it to some USB connection, transitioning it to the entire product, then to the real-time monitoring, and to give you an idea that whether good and moderate. And there is a history chart that you can generate, that what kind of history you are having over the entire span of your work. And there is an option of change your language. Because if we are going to the general public, they doesn't need to understand the English every time. Okay, it is not, we cannot expect it from people. Not even just we can put Hindi as well. We put 7 different languages to this particular device. So that in every aspect of the people we can, as much as rural sector, we can target. Because again, I will be giving you a cost comparison why we are going, doing such things, because yeah, okay. So the change, the language options is that 7. At right now, we are 7 different languages we are providing. And I remember last time we went to Inventive Hyderabad. There is one event of government agency of MITI, that is Ministry of Information and Technology. So they organized one event at Hyderabad that is called as Inventive. Over there, some of the delegates, they did interacted with us, and some startup companies were there. So they basically asked us to not just go for 7 languages, because we were at the south. And the funny thing is, we are at the Hyderabad, and our device doesn't support Telugu. So they asked us, oh, don't just put 7 language bar, increase your language database to at least 14 different languages of the country. So we said yes. So we are already working on that aspect as well. So there is always requirement, people, because we are already sharing this data, we are already giving this product to the institutes, the academic institutes, to the research institutes, and we are getting the feedbacks out of them. And we are slowly and steadily basically updating all these things. These are just technical analysis. I'm skipping that. It would be very critical, but just showing that here in this particular thing, I will just give you an idea that it is not something that in a blood only uric acid, that is the UA, is only going to sense. There is glucose, there is ascorbic acid, and many other parameters. All these things are getting into your system. Now, how you are just extracting out, how you are just making your quantum material such that it could only align with the uric acid, and it will give you the pure estimate of uric acid only. So this is the whole story behind that. Now, now comes the a comparison. Like, so I already mentioned you that this is not a very different technology, and this is not something that we came up with a new idea to do so. Almost such kind of work are already there that we found. nine different, you can say, in different 9 different countries. These are all most different work with different technology. Our technology is different, their technology is different. So all these technologies are different, and all their techniques are different, but still they are able to somehow detect their work. But all these technologies and all those things are not, still not at that stage that they are able to make a product out of that particular technology. So although the technology is available with a different, you can say, methodology, but there is no product for that. So all these countries, these are the work from different research agencies, research institutes of the international. So our work in comparison, we showed here. You can see some wordings over here. You may not to very much grasp that, just its LOD, that is your limit of detection. Now LOD is something which is as low as possible, the better your system is. So you can see our data over here. The sensitivity that I talk about in our the novelty case, what novel solution we are bringing. So this is the sensitivity. The sensitivity that we are only detecting this uric acid is about 98.3, something value, which is the highest among everyone. And the dynamic range, that at what, from what value to what value. Because if something goes beyond, you can say, I have already shown you that our range is 2.5 to 7.5. That is the normal range. But this is not something, if you make any of your device, any of your measurement, your measuring tool, if you want to measure 100 grams, would you make your device of measuring just 120 grams? Because if you are going to make your device just 120 grams and you are putting it 100 grams out of the margin of error would be higher. So your particular measurement system should be, because even if in our vegetable shops and everywhere, they have 1 kg of products to sell to you. And someone may comes who just want 10 grams, one mirchi, one adrak only, something, 10 grams. So their measurement skill would go beyond, because they will say, अरे मैं तो 1 kg का ही सामान बेचने के लिए वो मशीन बनाई गई थी ना. So that does not happen, because the measuring tool itself can range from 1 gram to 100 kg. So you can understand. So that is what the dynamic range is. So you need to cover a dynamic range of variations in your devices. Now comes the technical due diligence part. So we can claim anything. That's the two things. Like I already showed you, we claim anything. We can say our LOD is best. Our dynamic range is the most highest range. So how did we do it? Like just we estimated out ourselves? That doesn't happen. People, when we go to the market, when we go to the other, they want some kind of certification, they want some kind of validation. How you did it? So that is done. Okay, so this is the internal basic circuitry. I just wanted to show it. I thought to show it earlier. This is just a USB port where a device kind of thing is being aligned over here. Some values, some modules are integrated over here. Just pure electronics, nothing very special here. So this due diligence is done by IIT Delhi's FITT, that is Foundation for Innovation and Technology Transfer. These guys took almost a 1 month period. They analyzed our product, they analyzed our technology, they did thorough investigation into what I claimed in the earlier slide, that this is our this is our that. And then they give us an estimated TRL. TRL is nothing but the technology readiness level. Now, for any technology to come to market, it has to go beyond certain level of stages. Basically 3 stages, that is research. Starting the things with research, where a basic principles is observed, that is a basic idea. We started with an idea. So initially we started with this research phase. Then in the next phase of TRL 1, 2, 3, this comes under your research phase. Once we crossed this barrier, we completed with thoroughly ready with our technology, we justified that this is the this idea or this working principle is true and it could be established with the existing laws of physics, chemistry, and everything. So with existing laws, it can be proved, it can be done. So we cross this barrier, and one by one, most crucial one is POC, that is a proof of concept. So I'm just giving you an idea that whenever you are going for any particular product or any particular technology, you have to have cross all these levels of TRL, that is your technology readiness level. These TRL levels we didn't define. Who defined it? It is NASA. NASA defined this TRL level way back in their Apollo missions. During Apollo missions, they come up with such an idea that they want to launch some satellites, they want to launch some rockets. So how do they know that whether they are ready to do it or not? So they come up with such a detailed, you can say, analysis to categorize whether their technology is still ready for a go ahead and launch such kind of things. So they come up with the technology readiness level, that is TRL. And they categorize it in 9 different levels. Started with, because in a NASA, as an engineer, as a researcher, as a scientist, anybody would come up and say, oh, I have one idea. I can launch one satellite. That is just pure stupidity, because it cannot happen. One person cannot claim that he can do everything. So they tell him, okay, if you have idea, come to us, discuss. There is a committee who will verify that your basic principles are correct and not. Then your technology concept, whatever the technology you are saying, that although this can be done, but how to do it, these are the technologies. This, some circuit, some element. Like in our case, we said that quantum material can sense this particular uric acid. But we were at that stage at only TRL1. So we come up with technology concept that, okay, something we can do, some electronics we can extract out, some data we can extract out, some current, some voltage, some resistance, all these things, basic things, we can basically cache. Then we came to TRL level 2. Further, we designed, I showed you over there that one basic device which is just connected with 2 electrode system. So at that time, we were at the proof of concept. Once that proof of concept was approved, then we completed the research phase. Now we are nowhere anywhere between product. The product thing is still far-fetched. Once we crossed this barrier, we came to something called as technology validation in lab, that is development phase. Now the development phase will again subdivide into 3 categories. The development phase of TRL 4, 5, and 6. So we need to check whether we have completed the in a stepwise manner, we have to complete this development phase as well. So our research is done. Now we are into development phase. Technology validation in lab, we started at IIT Indore. We did it, we completed, get it verified. Then we went to the technology validation, the relevant environment. Here, the relevant environment is the most crucial aspect, because the validation is in laboratory is a different thing. In laboratory, we can make the entire, you can say, the environment is very controlled. It is nothing relevant to the real-time working of the device. So, okay, yeah. So the laboratory testing, the environment in laboratory testing is very much highly controlled, because we don't want to degrade our sensing layer, quantum layer, and we want very less disturbances out of the environment. Because if we are not able to concentrate exactly that whether this particular device is working or not, because of random factors, maybe environment temperature is different, humidity is higher that day of testing it, and another day there is our AC is working so cool that the temperature goes beyond even the normal working temperature. So we need to eliminate all those factors. So at that time, the laboratory validation is very controlled, very specifically done. But this does not gives you that whether you can just go to sell your product, because your relevant environment testing has not been done. So here in this phase, the AIMS Bhopal comes into the picture. Now they took up the device, they took up this testing methodology, and they validated. I already told you there is a fluorometry system, almost costing 1.2, 1.3 crores. So they tested their samples in that system, and they tested that same samples into our system. In that manner, we completed the relevant environment validation scheme. Then the technology demonstration. Now here comes we were at the POC, that is a proof of concept. Now the prototype comes in this particular phase. So the prototype that in back slide I showed you, so that prototype comes in this particular testing, and the same testing which has been done for our technology now has been done for the complete product scheme. So once that is done, we completed that phase. Now comes the most critical thing, which is the clinical trials. For any medical equipment, for any medical testing things, or any, even just say medicines, you must have known this word of clinical trials very well now, because we just crossed COVID. In the COVID years, we were hearing lots of news that clinical trial 1 is complete, clinical trial 2 is complete, human trials started, human trials complete. So what are those? Those are specific set of, you can say, policy, that how things need to be checked, how things need to be tested in order to realize its efficacy. Now what is this efficacy? Efficacy is, you can say, the allowable error in case what will happen that this COVID medicine will be given to 100 people. And out of 100 people, if that COVID vaccine is giving better results in 66 cases, its efficacy is 66. So in that manner, this efficacy was estimated during the COVID times as well. So even the COVID vaccine, when it was passed, its efficacy was nothing beyond 70 to 75. That is, only to 70% times it would work. And that too, it would not cure it. It would just be improving it. So we may not at that time understand that whether we are getting these things highly, you can say, whether it would be beneficial or not, but because that efficacy worked, because those researchers, so much research goes into that, so much time they took, so much finances, so much money they would put into it. Slowly they started increasing the efficacy, and to beyond 80, 87% time. So right now we can say that COVID vaccine didn't work at that time, but you should be looking to the research data and the published work. It worked very well. So because it improved the efficacy over the time. And that is not just the thing that those guys or those COVID vaccines are only working. Every medical industry, they are doing the same thing. So for going through this testing, we need to understand that now we are into the clinical trials. So the clinical trials will be undertaken by some medical institute only. It is not that as a technical company or as a technical institute such as IIT, they can do it all alone on their own self. Some medical institute, those experts, they only could do so. So for that, there is entire list of documentation need to be done to arrive it. So we already almost completing this thing. And readily, once this critical part is passed, we already are into the deployment stage for this particular technology. So this is what I was saying, that clinical trials, that is ethical documentation. So this ethical documentation is the most crucial to undergo for any human trials, for any clinical trials. We cannot just randomly go and ask someone to just take out your blood and put it into this machine and I will test it. this things not work in that way. For the industry, they need some ethical documentation. So once you arrive, so it took us a lot of time to bring these two institutes, that is IIT Indore and AIIMS Bhopal, all together and make this collaboration ready with the Professor Jagat R. Kanwar, who is a professor and HOD of biochemistry at AIIMS Bhopal, and Professor Shaibal Mukherjee from Department of Electrical Engineering, IIT Indore. So here this collaboration was done, arranged, the ethical documentation is ready, and we are already crossed 4 phases of clinical trials. So that is the current situation that I'm giving right now. We already completed 4 different clinical trials, and right now we are into the blind clinical trials, and there will be one more clinical trials will be there, which is something called as we put fake things, that is fake value, fake testing kits and the real testing kits. And in that manner, we compare those results. So that was the last phase. After that, it will be the deployment ready. So 4 phases are already completed. So what USP we are bringing to this particular business? So, this is the usual question I have got in many of my pitching and discussion with many funding agencies, that what is the USP? Why should, okay, I prove them technology is good, I prove them there is a novelty. That is fine. But what is the USP? Again, you may say you have done something, you have improved, you have given some technology to the world which is way better than compared to your peers. But why I am going to invest in you? Why should I invest in such a thing? So we basically show them what is our product USP, or what is overall our USP of this whole ecosystem. Because not just product, the entire ecosystem that we have developed, it itself possesses some USPs. So if we can pitch such things, not just for the product, not just for the technology, entire ecosystem that we generated, that would be the best way to basically communicate to such investments and getting such kind of investments. So the USP, before discussing with USP, what I usually do, I compare it with the existing problems. The associated existing problems would ultimately give a better idea of what USP we can show. So what we are having, these are the foreign brands who are some sort of working with different technology onto a, you can say, urine detection only. We said we were working on the 3 different aspects, but it's not new concept. Already the concept is there in the world, and these guys are already in the market, mainly from China, Taiwan, and one is from India. But this company which is from India, it's itself utilizing the work from product from the China. So that is what usually the startups do in this country right now. Mostly the startups, they start here, but get the products from China. So that is what they are also doing. So again, the same cost, the accuracy and precision, that was the one major drawback, because, and we are not claiming it just right now, right away. I will show you the entire data that we tested all their products and technology with the AIIMS Bhopal. So we got the idea that how much accurate are these. And then high cost associated, because again, we purchased it in ourselves and we get it tested and took the per unit cost out of, per test cost out of the whole product analysis. I will show that as well. The sensitivity and the time consumption, all these things are the issues that I have already focused on one by one. And what best thing we are bringing, the operational advantage. In terms of operational advantage, the cost. I'm multiple times discussing cost. I will show you a comparison table, why I was discussing this. Power consumption. Because we are into this quantum sensing material, the power consumption is so less. Shelf life, this is the most critical, I already discussed with you. Although the products, they say they have a 5 years warranty or 1 year of warranty, the shelf life start degrading from the day one you utilize their product. The quantum sensor itself is our USP. Its selectivity, response, accuracy. And all these products have a major drawback. They do not provide real-time values, real-time monitoring ability, or even you cannot record or the data cannot be memorized by their devices. So we provided what is something known as IoT, IoT enabled. And everywhere there is a talk right now that things are moving towards more AI, artificial intelligence, and Internet of Things. So as we are moving towards 5G, and right now the talk is already for the 6G. So the Internet of Things would be our, a way of life, way forward. Okay, so we are bringing those things already integrated with our product. Then the whole ecosystem I was talking about, that is, we are into the clinical phasing trials of that. So we have 2 patents out of this particular technology. Now this IP right production is the most crucial things for any particular, you can say, startup, any particular group, any particular people who are working into some kind of product and technology. You need to have some kind of IP protection. Because if the things are, whatever you can design, the electronics you are designing, it is something that everyone can do also. Anyone can challenge you also. If you have the product and you just launch it to the market without proper IP protection, anyone can claim that, okay, they can also do it, because it's not like something you are making some motorcycle. Okay, so right now, you can say, motorcycles have come to such point that even a mechanic guy can make it. But now, why not they are doing it? Why not anyone can come up to market and say, I will make another motorcycle today? Because many technology of that are IP protected. Hero Group, they have their IP protections. Bajaj, they have their IP protections. So you have the DTSI engine. You can take it out, check its molding and everything. You can go to any steel shop or something, molding shop, and get the same kind of engine. You can do it. There is nothing you cannot do it. It's not, if I can see maybe 30 years back, it would be very difficult. It won't be possible to make it. But right now, today, it's not something that you can't do it. But still, you cannot do it because it is IP protected. You cannot make a DTSI engine and challenge the Bajaj that, oh, okay, we are doing it. So this IP protection is very critical. So this is the making a complete ecosystem of USP. So here finally comes that part of costing, which we were doing it, and this rigorous analysis. This is not just we took it one time and just tested and done it, oh, okay, this was the cost. This was a rigorous testing. And this rigorous testing was done at both the academic and the industrial level. At every different platform, from IIT Delhi, from IIT Indore, from AIIMS Bhopal, everywhere. And even the Technology Innovation Hub, they are also into this kind of product, and they are analyzing, because the Technology Innovation Hub, that is also a T-hubs, are being accelerated by the government via Department of Science and Technology. So they are also into such kind of work where they are testing it too. So you can see the costing of individual devices over here. We are estimating our product price to just barely and minimum to 26 rupees for one test kit. And I already showed you that the testing that we did over the time period, I'm just showing near about 5,000 to something 11,000. The actual cost went to 60,000 as well for one particular actual product that I already showed you. If you go for chlorofluorometry testing, the one test cost you 60,000. And this is for one cost per test, means you have to buy, remember, you have to buy for this particular product, you have to buy 30 strips. Now you can compare for the 30 strips, what would be the cost. So this is just an overall idea for different countries with different parameters and with different companies what they are actually working upon. And we have also given their USP as well, because it's not right we have different kind of USP. Others are also sharing their data, they are also pitching their work as well, but the drawbacks are mostly influenced by the cost and the methodology they are utilizing for the comparison. Now this is the part where I've shown you that the errors, that is the accuracy part, where different products, how they stand over here. So, starting with here, this is the particular value, just forget whatever the parameters are written. This is the particular value which arrived from a chlorofluorometry test from AIMS Bhopal. This one particular test cost around 60,000, getting just one test done. So this is the most highly accurate and most, you can say, acceptable value of the particular sample. Whatever the sample was here, that gives some value. We compared, we took that sample again and utilized a part of that, because this, you can say there was a capsule of tubes of capsules, and we took out the sample, one tested over here, one tested over here, another here and here. In that way, we tested the results. And you can see the error margin as compared to the highly and most accurate thing that we can get in the today's world. This is our product which was showing at around 1.5% error. This was the market giants. Those also claimed that they have their product ready with that. You can see the margin. And here you can see the margin. The error margin is 17.8%. And this 17.8% is consistent throughout. You can see somewhere it goes beyond 22.4%. Just the values that you are detecting, what range of values you are detecting, what condition you are detecting, we kept most of the parameters which are in our control as a constant. Temperature, constant. It's not like that we are measuring this at 20 degrees centigrade and next day the temperature was 30 degrees. So we kept most external parameter constant, and in that time we undertook this particular in-depth study that what was the accuracy of the actual samples and what we were claiming. And you can see we got the maximum error percentage of 4.19 in one scenario. Mostly it was fluctuating at around 2.5%. And you can see in other product, almost 25% of, if you are giving a medical data to someone with 25% of error, I don't know what to say. Basically, it's not acceptable. So your error margin tentatively should be less than 10%. That is what acceptable to any cases, because even your BP measurement, the equipment you are using right now, just with the electronic equipment you are having, that also has an error margin. You can just check the product and check what accuracy plus minus percentage they are giving it. So they must be giving it 2.5% if it is costing very good, like maybe around 5,000 to 10,000 of system, it will give you a accuracy of plus minus 2.5%. And if your cost is very less, that your system is maybe of around 800, 900 purchased from any Amazon or with some sale value, the error margin would be around plus minus 10% or 12%. So that the costing itself to get the accuracy is basically, you can say there is interlink. The higher the accurate system you want, the more cost you need to pay. The best accuracy you can get in the system, pay 60,000 for one test. So in that scenario, I've just given you a comparison of the whole story. Now comes the market analysis, because maybe you all are more into these things and you understand better than me. I'm just a technical guy. So, but still, we undertook some kind of scenarios. So where our product stand? So we focused on a market which is called as biosensor market. Biosensor market includes glucose level detection as well. The biosensor market also into keratin. There is also a biomarker which also being detected, and various other biomarkers. All these things you can detect. So there is a market of already around 25.5 billion. This is a global market, not just in India. Overall, globally, a $25 billion industry is already here, which is, we just need proper technology and proper catering to such kind of things. Now, the estimation is not that it is anywhere going to die down. Over the years, with a CAGR of 7.5%, it ultimately goal is to reach near about $36.7 billion by 2026. And the recent estimate I got for the 2050, it was approximately, they are suggesting to 60, anywhere between 60 to 70 billion dollars of industry. So, this is the global industry, we understand. Now in that global industry, who is the, basically, you can say the largest growth region. So the largest growing region is Asia Pacific. That is a region about our Indian Ocean and the near about the Pacific Ocean. This is the Asia Pacific. And in that we can see that the market where our product is being focused, that is electrochemical based sensor and the embedded sensors, this is already holding the largest market share. In that particular biosensor market, where the largest growing region is the Asia Pacific, the largest market share segment is the embedded devices. This is the same embedded device technology that we are also into. And in that embedded device segment, the maximum market share is being taken by home diagnostics. Home diagnostics is what? That I was already mentioning it to you from starting, like your glucose meter, like your uric acid meter, what we are pitching you, and different things. So the things which are readily available in your homes comes under the home diagnostic, not to the healthcare. Because if the healthcare already, they can spend a lot of money as compared to that. So that largest market application currently is holding by the home diagnostics. And by country you can see that, of course, China and Japan, they are already the leaders in this particular segment. India, in the case, is lagging behind, but not too far behind. That is the main thing. The growth of the acceptance of such home diagnostic market is booming in this country. And that is where the entire scenario comes off around this particular picture. So we have some big sharks as well, so some big, you can say, market leader as well, Abbott. This is the giant in biosensor market. But they are not catering to uric acid. That is one thing that till now I found out. And Bayer AG, which is from Germany, they are also one of the big giant also in India. They have a lots of investment, lots of product, which we don't know. But these guys are basically manufacturing and transferring it to other companies, and they are basically selling it as their product. So they have a big presence in India as well. DuPont, another US company, they have a big presence in India as well. But all these things, mostly they are into either glucose market or into blood pressure segment, which is very generalized and readily available to normal public, and the people, they right now understand. So that they have placed their product only and limited to those particular aspects. So there comes a gap, because already doctors, medical professionals, they are already understanding the biomarker presence and the value of uric acid and getting those data. Nowadays, if you get admitted to any hospital, basic test they will do definitely for the uric acid testing. They want to know what is the uric acid variation. So this is the complete market analysis. Now, we also made a business proposition out of this particular aspect. That is, you can see here, this is a canvas. In this particular canvas, you can understand in some point of things we have mentioned that who are our basically partners, whom we are basically partnering with. There are hardware partners with ourselves who are basically manufacturing our basic hardware components, because semiconductor industry is such a you can say nicely placed in our ecosystem that we need to basically rely onto the best hardware manufacturers, and you cannot do it in-house. That is the most critical things. App market is already there that we are catering to, and we are already working upon that aspect. And definitely before going to public, we got the public acceptance of any kind of technology and product, we need to get it basically accepted basically in your regular utilization with hospital and clinics. And the government agency and hospital clinics are work well in together. Then retailers, cooperatives, some university research institutes, all these are our partners existingly we have already accomplished. Then comes the most crucial thing, the resource, that is the core of our whole business model. We put the whole core around our technology, around our business model and IP rights that I already mentioned. Around this core comes the hardware production activity, which we will be doing with hardware partners. Remember, this hardware production is of the basic components being fabricated, not the main alignment of the entire electronic industry. That requires this IP right. Which kind of components, which kind of circuit, which kind of designs you need to, because there is an entire electronic designs we have implemented using the quantum sensing. So that is IP protected, that cannot be done by anyone. So this hardware production is basically the entire product production is basically in-house. The app development is in-house. We have the right to basically give this to any particular OEM by something called as technology transfer. So that TT methodology, technology transfer, we have that option ready already with, and we are already in discussion with 2 different units. One is from the Hyderabad. That also we had a detailed meeting recently in Indian Mobile Congress. Recently happened in October 1st week. I was there in the Indian Mobile Congress. So we had a in detail meeting with them regarding this OEM. So now comes the value propositions, which I have already discussed in detail, the real-time monitoring, early disease detection, because these are all our USPs basically. So that USP is giving us the value of this business. And through the marketing channel and the customer involvement, because the individual patient with gout is what I already mentioned, the disease, government agency, hospital, and doctors and professionals, we are basically giving it as an entire customer segment. So main thing comes the finances, where our cost will go and from where we will generate the revenue. Our expenditure will be in manufacturing, will be maintaining the server, because I already told you this is a IoT enabled product. So it must be utilizing a lot of data, integration would be required. R&D, lots of expenditure goes to the R&D. And some distribution, this is a later part. So this is the main expenditure aspect of the cost. And there comes the revenue part, from where we are going to arrange the revenue. Hardware sale, most common thing, because we are a product company where we will be selling our product and getting the hardwares, and this will generate our revenue. This will be covering our major portion of the revenue. Almost expected to be 70 to anywhere between 80%. But the profit margin in the hardware is very less. So the revenue will be mostly generated by the hardware sale. The profit will be generated by the app-based subscription. That is the app that I have already discussed with you, that will be giving you the real-time data, everything in your mobile. That subscription-based model will be generating the most profit. The most revenue comes from the product. The most, you can say, profit would comes from the service. Okay, so this is the industry that we are making the business proposition, that we are not just a product company, we are into the service business as well. Product plus service. This will, if you make such kind of technology and give it to the, you can say, bring it to the market, you have a very good proposition. You may have a very large chunk of, you can say, VCs, and everyone they will be interested to basically get into, interested into. Then data insights analytics. This is one, again, the most critical aspect, because although a lot of time I already mentioned you IoT integration, that is Internet of Things. What about the AI, artificial intelligence? Now comes the data insights analytics. Your history, your data record, based on that particular data record, considering, definitely considering the privacy laws into that, what analytics the system can generate for you, whether you are having in verge of any particular hyperuricemia, hypouricemia, and getting into the telemedicine, what all that aspect we can cover. This will be covered by the data insights and analytics. All your data can be basically analyzed using big data and different available technologies in order to get into your understanding that what kind of medicines you are going to purchase. It will be predicting, it will not be suggesting it to you. It will be predicting all those models. And all those models, when they are predicting, they will have an idea that what kind of products you are going to use, what kind of supplements you are utilizing, what kind of doctor recommended medicines you are using, and based on that complete data insights and modeling, we can estimate what will be the requirement, where are the most patients in which particular region, and what kind of warehousing, what kind of entire industry movement of the products would be required, including basic supplements, medicine, and everything. That is the most critical part. We are already working in that aspect. Currently, it is not part of the entire proposition that I have discussed today, but this part is the most critical one. And that could only be done once our clinical phase trials and deployment phase was completed, because we need some particular data insights, and it's not something we have not experience with. I already told you we are into 3 different segments. We are into healthcare that just today we discussed, and we are also into environmental monitoring, and we are into the soil and the agriculture sector. In that agriculture sector, we had already implemented this. And we already got so much better results, and we got so much, you can say, the customer segments, everything we have in place for that agricultural product. So this data insights analytics is basically, right now, it giving us 0 value, but in future, this will, I think, the entire profit margin would be covered by almost, I am predicting it to be 70 to 80% of profit would come from this one particular aspect. So we are into product, we are into service, and we are into data analytics as well. So that is what the overall thing and overall story is behind. So now comes to the future plans. This future plan, this healthcare device only, that is uric acid monitoring system. Uh, we usually always discuss a short-term goal, maybe near about 2 to 3 years or something, and a long-term goal, that is beyond 10 years. So in short-term goals, we must be very specifically, and we should be knowing what exactly steps we are going to undertake. We need a better product refinement, that is for sure. We'll be basically, you can say, strategizing and discussion with more medical experts are required. And then the product optimization, finances, and the pilot testing. Pilot testing of not any prototype or any clinical validation, the actual testing, the actual selling of the product, and actual data generation, and then analyzing all those data and the feedbacks. That comes under pilot testing. So this is the next 2-year plan to be completed. Next 10 years, of course, we want to go to the mass production and public relations. So that was the major objective behind doing all. This is some strategies that I just wanted to show it to you. It has nothing to do with the product. It is more kind of do it with the entire ecosystem, entire startup culture that we have developed. We started discussion with technology development, basically the R&D part. Mostly R&D part we undertook as part of the technology development. And we mostly highly invested into this aspect only. Right now, nowadays, we are moving ahead, just not completely relying on the technology development, more towards the, you can say, these 3 steps altogether. That is idea to commercialization. I already told you technology readiness level, which is the most critical aspect of that. IPR generation, because going any further with your product, IPR generation is the most critical thing. Your patent, publication, trademarks, design registrations, all things need to be, your trademarks, all things need to be protected. And all these things will also give you more value to your product. If you can show to the research and the scientific community that you have published so much research work and readily available to the community to basically go and check whether your things can work. Just like I was discussing a case of COVID vaccinations. So COVID vaccination, you can go to the Lancet Journal. And all those data that I was discussing with you, you can check in the Lancet Journal and see how the trends was there, how the data was, efficacy was there, everything you can find in the Lancet journals. So general public can say anything, general opinion could be anything. That fact thing you need to check, you have to go to the scientific community journals such as Lancet. It is the most highly reputed journal in the world of medical science. So such kind of things we also be looking into. We will be pitching, we'll be going for that particular patent publication work as well, which will be just a additional value, will give you additional security to our product and our technology. And also a self-confidence. That is what I was just on. Translational research strategies. This is the basically our vision from the starting. We were just usually you can say we were a lab rats. We just working to lab, and we start our day from 9. We end up our day sometimes 8 p.m., sometimes 10 p.m. So that is how we were working to the labs. So this is just the lab work, but we didn't want to stuck with that. We want to a transformational and translational work to be done. So with the help of Professor Shaival Mukherjee, Professor Pallavi Mukherjee, and many more, my co-peers, Dr. Chandran Patel, Mr. Sumit, all those come together. We sit in lots of meeting, we did lots of consultation with each other and also with the expert, because in the starting phase, we didn't had any knowledge of that. So we just started with random things, and then the discussion that you can say chai pe charcha jo nikli wo phir aage tak chali, so that's what the whole idea was behind that. So truly this is what justified our company L2M, that is lab to market. And this is our whole thing, glimpses of some of our outreach activities. We always look into these kind of outreach activities such as the one we are doing today. And the things is actually, such kind of meeting, such kind of discussion is actually helpful for us as well as to yourself and to the community as well. So this is one way of giving back to the society. We just wanted to let them know. We give first-hand experience how quantum methodology, quantum technologies are being done, how is at what level. You can see the entire deposition systems, the entire laboratory experiences we are trying to give to some students. So even if some of you are interested in, or your students are interested, you can please contact us. You can look into this contactl2m.com website, and you may reach out to us. We will definitely arrange some kind of, you can say, more in-depth analysis kind of things. We can give you or your students exposure to that aspect. And these are some granted patents. The best technology award we got from IIT Indore. This is the material next from Tata Steel that we were one of the finalists over there last year, 2023. And we were the first runner-up. There was another startup which actually won that grand finale, and we were the first runner-up in this particular competition. We are a DPIIT recognized startup. We got this recognition just in 1 month of our you can say starting registration. Just 1 month we got this recognition. There are some, you can say, news highlights, and the critical thing that I was discussing, the clinical trials at AIIMS Bhopal. You can see Professor Jagat R. Kanwar is here, and we also demonstrated at in Hyderabad inventive event where we interacted with Honorable Minister of Education. Here you can see some Transformational Research Foundation Day we are integrating with Professor A. Karandikar, who is a DST Secretary, Government of India. And on individual aspect, if I talk about this particular whole research to translational work has actually helped me as a grown in this such kind of things. I was awarded Madhya Pradesh Young Scientist Award in 2024, and all these things. I was also awarded Global Student Entrepreneur Award, and recently the EcoSense Innovators Award, the IEEE Women Engineering, for developing a solution for climate tech big idea page. So all these things are there. So comes around the funding agencies. You can look into, there are in our starting phase, these are the very crucial one, because for any product development, basic things, you need some kind of seed support, seed grant. So we got IANSH funding from Technology Innovation Hub. This TIH is department of comes under Department of Science and Technology, but itself it is a you can say Section 8 company. So this is a different entire entity which basically works on the technology innovation. So we pitched our idea, everything to them, and we got some grant. We also, one of the seed grant we got from Startup India. So that was a government-run scheme, and various financial supports from IEEE throughout our journey at various different aspects. We got some funding from the IEEE. Collaboration was very critical, because in order to get into such kind of technology, we need to have some experts and domain experts, and you can say who can basically guide us as well and collaborate us as well. And the most thing is the critical aspect. They need to put the criticize our things. Once these are not just collaborators, they also criticize our technology. They come up with some kind of problem that your device is having this kind of problem. So if that stage, in the early stages, if we point out, get so much of problems out of our devices, so or our technology, so that basically helps us. So all these institutes, especially the AIMS Bhopal, who has basically done the entire clinical trials and everything in collaboration with us, and the external international experts from the RMIT Australia. So these both have helped us a lot in this particular work done. And I will leave you with one short entire history of maybe journey, I don't know. There is sound in TV. So this is a very scratch work. Basic research work. I was telling you, remember the TRL level. Starting TRL 1, 2, 3. This, at that time, this is the story. Basically doing just our research work in our lab, what we usually do. Now comes some designing phase. There we are started some designing, and this is a prototype development kind of thing. So we are not into TRL 4 or 5 anywhere. Now this is 3D printing. So from proof of concept to the prototype. This is the journey, and some kind of testing we are doing, clinical trial, basic starting of the clinical trials or something. This is the development of the products. So this actually is the clinical trials at AIMS Bhopal. Earlier that was from the laboratory testing. This is our core team. And this is our extended team members. So now lastly, I leave it with kind acknowledgement to Professor Kalicharan Modak sir and Professor Pallavi Mukherjee for inviting me to this today's talk, and also special thanks to the program convener Dr. Vivek Singh Kushwa, who is the director and professor, IPS Academy Indore, and the patron members. Special thanks to Achal K. Chaudhary and Yogesh Jain from the IPS Academy. So thanks a lot for today's invitation, and thank you. So if you have any discussion, if you want any questions or anything. Yeah, so what we did, right now what we are utilizing it, and we are looking into the strip that we have right now for the glucose testing, we usually do it one and throw it out. The sensor that we are utilizing, this has this quantum sensing layer, uh, we are going to utilize it for 50 times. For one particular strip, you can analyze your uric acid level 50 different times. So that is what making the cost so much less.
And just for the sake of clarity, the sensitivity which you mentioned was ampere meter inverse, which I got.
Sorry?
Sensitivity, you showed devices, different devices and their sensitivities.
Sensitivity, yes.
It was
It
mentioned
was microampere per mole.
microampere per
Per
mole.
mole.
Okay. And the final thing I would like to ask is, India is a huge country, 120 crores plus people. Out of that, how many people actually require such tests?
Yeah, so that is very actually interesting thing. So, first of all, our idea of giving so much, bringing the cost so less was to even we want to penetrate to the rural sector. So that was the main idea. But the idea is different. Our vision and objective is different. In on ground things are different. On ground, we can basically start with just the hospital, health center, clinics, because how the you need to check the journey of this blood pressure monitoring system. That blood pressure monitoring system usually still in many doctors you will find that wo punch wala speedometer. So starting from that, doctors in their own clinics started utilizing the digital one. So people go and used to check, okay, this is the digital one. Although the size and the things, complexity was because that is more accurate. The cost was different. But when people started utilizing it, they got used to with that. So now they can also purchase it for their homes. So just to get the idea, okay, some what readings are. Even in my family, it was still sometimes that value comes out on 140. My mother say, oh, it's around 120, it's fine. So now at least they adapted to it. So we are into that. We will start initially with all those channels, and then we'll slowly enter to the market where only 1% and 2% population are there. That upper middle class. Started from there because the profit margin could only be generated. I'm not targeting 100% on reality on the 100%. Though once the utilization acceptance in the public will be increased, then even spending 26 rupees, it would not be like something, it could not be afforded by common middle class or lower middle class people as well. So initially channels, hospital, clinics, phase 2 of this sales would be to the higher middle class, and then slowly coming to this. And you know, 2% of 140 crore, there's a huge market. So we are just looking to that.
And final question is, what would be the cost of the device and the final selling price? which
Okay,
you are
yeah,
looking
so one thing I think I missed, overall device cost is something very tricky part. At this stage, if I give you one short answer, I cannot say, I don't know. At this stage, I don't know. So the unit cost that we estimated is lacking a lot of parameters. I will give you one, I don't remember if my teammates had added that aspect, because we did a thorough analysis. Yeah, you can see, we did this thorough analysis of our one individual testing. What was the sensing layer cost? This sensing layer cost itself, we did considering we were fabricating almost 50 different samples one at a time, all at a time. So in that aspect, we analyzed that what was the sensing layer cost, then what was the IDE's cost, that is the overall quantum sensor. These two will make the overall quantum sensor. Then some other consumables. So overall the testing price of complete electronics would come around something like that. And we just make it that for 50 test kits, on an average, what would be our cost? However, this major thing which is lacking is manpower. We didn't extract any salary out of this particular thing. So we cannot estimate the electricity charges. We were fortunate enough. IIT Indore provided us with the infrastructure. We are not drawing any charges of electricity. This is the major bottleneck for any industry. The electricity charges. Just recently, I heard that till now we were learning about the news that the industries are shifting from Mumbai to Surat, Gujarat. There is another scenario. The textile industries are getting transferred from Surat to Maharashtra, because the Maharashtra has a low electricity cost, just around 3.5 rupees to 5, and the Gujarat has around 8.8 to 10 rupees. So just because of that reason, the textile industries are shifting from Surat, which is the core area of the entire textile. They are shifting from there to nearby border, just the border of Gujarat, but it lies under the Maharashtra. So that is what the interesting thing is. We are not estimating that price. Then the machine charges. I already told you the CVD system, the quantum development was the around 20 lakhs we had spent over there. So we have not included that aspect as well. So currently I am not giving any particular costing, but individual cost something which is around 26 INR. Even if we integrate these costs and go for a bulk production, because at that time all these costs will be decreased. Although this will be added, but these costs will be decreased because it will be going for a bulk production. So in that scenario, the cost may vary, but it will be dirt cheap as compared to what we are having. That was overall idea.
Thank you, sir.
In future, you are going to produce or manufacture the device, or you're going to give the technology transfer?
Yeah, so idea was initially to manufacture it completely. That was the idea. We started the work and we laid the foundation, everything to manufacture it completely. Later on part, after much deliberation with many of the VCs and the funding agencies, especially the TIH, that is the Technology Innovation Hubs, we realized it would be best to give all the technology transfer to particular OEMs. So right now, we are into discussion with the OEMs, because getting into the manufacturing facility and the costing, who will bore it? So once we cannot prove, until unless we cannot prove that this is a major market and this will generate a major revenue and it will be sustainable on its own, and we don't need to rely on our agriculture product to take out the money and then utilize some fund for this particular aspect. So until unless we cannot prove it, we cannot go into manufacturing. So the best thing about OEMs is, you must have heard about the Dixon Technologies. So any television that you are utilizing, be it Haier, Samsung, anything, LG, Sony, everything, all are manufactured by just one company, Dixon Technologies. All your ACs, LG, you say Voltas, any AC, you just name it, any brand, all are those manufactured by one company, Dixon Technologies. So that is the way forward, moving forward. You have a brand, you can make a brand, you can make a product, you can transfer the technology. What Apple is doing, Apple is not manufacturing. Apple is doing to R&D technology transfer. Foxconn is making it, and they have multiple all those things. So we are, although truly would I say we started this work with the objective that we'll do it, but on the line we realized, and even those are the industry experts, those also had a lot of meeting with us, a lot of deliberation goes into that, and we also realized that it's not feasible.
Because I have worked, I started my career with the IIT Bombay startup. So they develop the product and they pass it on to the ILFS.
Kind
So
of,
that is where,
that is, I believe.
and what about the data? I think the major advantage of where you are going to generate the revenue, you
Yes.
said 70%, I think it's 90%, 95% is
You're
going
true.
through the AI and the data.
You are correct,
I
definitely.
mean, that is the thing that the whole presentation and one's canvas and that one point
Exactly.
that excited me a lot. I mean,
I understand,
okay,
exactly.
I mean,
Thank you for that compliment. And
Thank you,
yes,
thank you, sir.
I do agree with you that the entire, I may have estimated it less, like correctly you said, even the entire profit generation would come from that aspect. Exactly. That collect the data. Exactly, exactly. That is also the same idea. I'm also looking to that. Yeah, correct.
Sir, question. So what is the test range as you have mentioned about different companies? What will be the test range for your product? I mean between X to Y, mg.
Sorry, test range. I didn't understand.
टेस्ट रेंज मतलब 2 मिलीग्राम से 20 मिलीग्राम के बीच में यूरिक एसिड है.
Okay, for the uric acid, what would the amount would be required?
नॉट अमाउंट,
Uh,
द टेस्ट रेंज कि मेरे ब्लड में एक्चुअल यूरिक एसिड का अमाउंट कितना है.
that is into the unit for that purpose is microliter per decamolar. That is the unit. What I was saying, the range of 2 to 7.5. It was just a range.
It was 3 to 7.
But our system is measuring starting with 10 micromolar to 100 molar. The range we are targeting micromolar to hundreds of moles. So that was the range we are targeting. So it will cover entire range even beyond.
Even
So that
beyond
is-
the limit. Okay, what will be the price? What will you suggest? I mean, should we change the sensor after 2 years, or should we buy a new machine after 2 years as the sensor will start depleting?
Yeah, I would suggest that we are testing it for the 50, like one particular test,
Once-
entire sensing layer, we are giving it as a fifth set of 50. We are not giving the sensor layer one and strips different. You need to understand the sensing layer and the sensing circuitry methodology inside a in-house circuit. This is one, and the testing kit that we use for the blood glucose that comes around like 2030. What we are doing, we are entirely removing these testing kits. Directly the sensing layer, we are giving it as a sensing strips, like 50 we are giving it
Okay.
to you. Now one particular thing will be utilized by 50,
50
that
times.
we have done. But when we go to the public, we will say don't use for 50 because we have done 50 times. But we will be claiming that it is good if you use it for 30 times. Because although you can utilize it, but all I have told you that once you start utilizing the sensing layer, it will start degrading.
So there won't be any need to change the device for a
No,
longer run.
for the device,
The
you
white-
need to
white
change it.
device.
Just the electronic component would ultimately degrade after 5 to 10 years. So that is different. But the entire sensing layer I am giving you as a separate thing apart from the device.
Okay, in your presentation you mentioned that your device contains GSM, GPS, everything. So what is the need of GPS in this device?
Okay,
I can
so
carry the device in my pocket now. That's
Yeah,
quite
exactly.
easy.
So basically, that was the main idea. Just was to transfer the data to the cloud. Hello. Hello. Okay. So the main idea is to transfer the data to the cloud. That is the main objective because we have integrated the cloud computation for that for the data analytics and modeling of history and everything. So to transfer the data, we need some kind of internet connection. In order to maintain that internet connection, there are 2 to 3 things. Either every time your mobile should be there with you and it should be linked via Wi-Fi or Bluetooth to your device. So that is one way around. Now what happens if you don't have an internet connection? That time the GSM module will be there which will directly utilize the internet facility and upload the data to the cloud. So that two aspect we are trying to basically communicate with.
Okay, is your product actually launched right now or it's under
It's
process?
not launched into the market. We have that product right now. Don't have, but we have that product. So already showed you some of those images, which is actually the product, not just the schematics. Like this one. This is the actual product. You can see over here. This is the main one. So the one we showed it in the video. This is the actual real-time product. You can touch it. You can feel it. It's just not in the market because I already told you it is in the TRL level 7. And we are moving slowly to TRL 9. Once TRL 9, then only we are ready to launch to the market.
Okay. Is it possible to create any device like this for lipid and all?
Exactly.
Quite
Because
easy.
we need to know what medical biomarker is there, biomolecule is there. What biomolecule and what particular biomolecule, okay, I will show you that as well. This thing. So we need to know the entire chemistry of that biomolecule. Once we know this entire chemistry, what particular sensing layer with what particular quantum doping with quantum layer, which can be make a analyte of these two, particularly sensing only this part of the material, because you need to understand this is chemical. It will not be always stay around this will move. Something composition will always change. So what composition this will be, you can feel it by giving, maybe this is negative, this is positive. Positive, negative, these are attracting. These are data analytics is same. That data modeling, analytics, cloud computing, mobile application, in single mobile application that I showed you, I think, I don't know, these guys have used the correct image or not. Let me check. Yeah, you can see biosensor, medical, there is agriculture. So the same application with same integrated model history and data analytics, we are going to utilize for that.
So for the individual, which kind of a strategy, marketing strategy and advertisement strategy you are going to use?
Okay, so no advertising. Another was sensing uric acid. So in that manner, once all these channels will be comfortable, they will be utilizing, you are going to be with that, then only you will be thinking, okay, I can buy that as well. It is costing maybe around 1,000 rupees, 1,500 or something, 2,000. I can afford it. So in that way. Okay, face like right till now, or you are saying the biggest challenges we are going to face in future. Yeah, okay. So biggest challenge is two things. First, that TRL assessment. For getting the TRL assessment, we know that quantum sensor material will work. But how it will work, whether it will work or not, to understand, to design that particular, you can say, entire documentation, entire process, and get it tested, that is one of the major hurdle and major challenge for. I won't say hurdle, because hurdle is something which will be negatively impacting you. But that was a challenge which ultimately positively helped us. So that was a kind of, you can say, a bottleneck for us initially, because we were new to it. So we faced one major challenge over there. Then comes the second thing, that we were so eager to get this product, because what happens in our agriculture product, we were so eager, we launched it. Nobody was there to stop us from doing so. So we were so excited to just go and use that product and go to the market and we'll do it. But then we faced the major hurdle that we cannot do it, because this is something relevant to the human health. When such human perspective come, you cannot do it as per your, you can say, comfortability. So we face major hurdle over there, but again, that was also another challenge. So with collaboration with AIIMS Bhopal, the clinical trials, everything, our learning curve was so increased that we enjoyed that journey as well. So right now, I already told you, we have completed 4 different clinical trial phases. And right now, just 2 are remaining. So we enjoyed that entire journey of that. So these 2 challenges are crucially that I can discuss with you. Okay, so for that, I have some data, not the entire picture of doing that. You can understand with something like this is called as standard of care. Now, to understand the clinical trials, you need to go into the lots of medical terminology and not too much technical aspect, but lots of medical terminologies. So they called it something called as standard of care. So this standard of care has some protocols. So initially what happens, you know that this sample has this much uric acid level. Now what you will do, you will get it tested from our device. This is a, you can say, how you can say that, this is just a artificial one. That is artificially uric acid, you know this one, you get it tested and you get some result, you matched whether this is coming or not. If not matching, you need to check your device, fine tune it, you need to get the entire design of you need to basically, every time after one trial, we need to go to our design board. We need to analyze our entire history. Whatever work we have done, we just discard it, start from scratch again, design it again, make changes, and then again go to the second trials. So in that way, this is just one short story I'm giving you. It involves serum, that is a blood serum, taking out from the patients with, with different diseases. You need to understand, I am claiming that the kidney disease will have an impact on uric acid, but if you have fever, viral, this will also impact the uric acid level. Now, you need to undertake such scenarios where a patient from cancer, where a patient from virals, where a patient from bacterial infections, where a patient from kidney ailment, all these patient serums would be undertaken into the study, and then the collaboration would be done that whether this data, the uric acid that we are predicting, that the instrument is showing, is due to this particular element or not. So that is another way, but I'm still giving you a very short story. The more complexity will come, there will be another person who will be a normal one. Now the scenarios will change. There will be a normal patient who will be, basically, we are knowing as an unknown. We don't know whether he is suffering or not. For us, it will be unknown. Maybe he was healthy or he was not. So that, you can say, that would be a variation in our testing scenarios. We don't know whether this, so the system should test the results and should let us know whether it has any disease or not. And if this particular system shows, the result shows, then we need to get the check done again. So, and again the complexity will change. There will be the patients whom we will let them know that you have some disease. Now your body will behave differently once you will be, you know that you have some kind of disease. And once we will tell you that although you have disease, but we will tell you that you don't have any disease, you are fine. At that time also your body will behave differently. So these two scenarios will again integrate into the search. So lots of scenarios are there, and we need to think of all those aspects in that. Both. We have 2 patents. It has to be patented. Even before clinical trial, it has to be patented. The entire machinery things. Exactly. Because machinery is not something, the components you have not developed, the capacitors, the inductors, or entire circuitry you have not developed, the designs you have developed. The entire designs is patented. And the sensing part entirely.
Sir, in the process of seed funding or grant you getting, so what the difficulty you face, because funding is the critical part of any project?
Making them realize to fund such thing which is not exist is itself a most challenge. These things, when we got funding, nothing was there. Today I can show you, I can give you the product, I can tell you just check your blood and something. So things you can feel, you can touch, you can sense, you can understand. You maybe have confidence. Right now, I've shown you all data, all results, everything. So you may feel some confidence on this kind of product. But at the time of funding, I didn't have anything. Blank, just idea. Now to pitch that idea, to understand them, make them understand, no, this can be done, this can be done, this can be done, we have done this, we have done that. That is the major point. I am showing, we till now we got funding from 5 different sources. We pitched for initial funding, I think around 50 to different sources. So you understand, from 10 to 1 ratio is there. When you go and pitch to 10 different areas, 10 different funding agencies, you will receive from 1. So that is the basic idea.
Sir, my question is that your sensor or system is limited to identify uric acid levels or glucose levels, or they can also identify or sense some critical illness like cancers or heart patients, something like that. And if they diagnose or sense some parameters about this, then how would you recommend or suggest about the future implications of that?
So to understand that question, basically you need to understand there is a concept of e-nose. E-nose is what? Like for one sensor, you are able to sense, for example, in this air, what is the content of carbon dioxide. There is one sensor, you can detect it. It will be basically detecting what is the carbon dioxide in this room. Now, I say that I want to know what is the sulfur dioxide level here. Then you need to go and buy another sulfur sensor. You need to put it here, then only you can go sulfur dioxide. Then I will say, no, nitrous oxide is also dangerous. What is the nitrous oxide level is there? Then you go market, search for nitrous oxide center, like put it here. Then I will say, no, 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 methane is also very dangerous. What is the methane level in this particular room? Then you will again go and find methane sensor. Then after 4 or 5 times you realize that this guy is making some kind of fun of me. So you will go to market and say, give me an e-nose. That e-nose will constitute around 5 to up to 30 different kind of gaseous elements and sensors. So if you brought such kind of sensor which can detect 30 different type of anomalies or different type of analytes or different types of gases, from carbon monoxide, carbon dioxide, methane, oxygen, nitrogen, whatever this guy will ask, this particular sensor has everything. So how it was arrived, various different kind of sensors are integrated into one kind of product. So that is the way forward. The carcinoma cells are
Because in medical sciences also, they are not, very much confirmed and assured about
Exactly.
the disease severity.
So the way of moving forward is, like I already said, the glucose and uric acid will be integrated. So I am giving just 2 biomarkers. The actual what will happen will be different. Maybe there will be a creatinine, it will be integrated like the sir has mentioned. Already there is a work, 3 different parameters are already, 3 different sensors are already integrated into one. What will they will do? These two, glucose and uric acid, they will integrate into 5 different sensors. Carcinoma cells can be detected, already proved with some magnetically dipole aligned sensors are there. It can be integrated, they will do it as well. And there will other disease elements, all things can be integrated into that. So this will be way moving forward, but right now there is no hard proof or concrete proof available that it can be done or not. Maybe it fail, it won't be able to do it. But for the gaseous or environmental sensor, it has already been proven. So the things also, the same question arise at that time as well. So like for methane sensors, why to look for different, just put one.
Thank you, sir.
Thank you so much, Dr. Mayank Dubey sir, for enlightening us on the topic AI IoT enabled quantum biomedical sensors which is related to healthcare. So definitely the way your team have worked on this product from initially thinking about the concept, having lots of research and development, then coming with the prototype of the product. And in future, I'm sure that this product is going to be a disruptive product in the medical or healthcare segment. So congratulate for that. Now I would like to call Professor Shivangi ma'am for presenting a vote of thanks to sir. Ma'am.
Thank you so much, sir, for enlightening session on quantum biomedical sensor with the green sustainable development. This is Assistant Professor Shivangi Ameria, extending my heartful gratitude on behalf of IBMR IPS Academy to our today's expert, Dr. Mayank Dubey sir, co-founder director at Quantum 2M Innovation Private Limited. Sir, your session covered the traditional methods and trends in real life. Your expertise and command on the subject give all of us practical application of theoretical knowledge with ground reality. Your innovation of quantum sensor is actually a magical pill which early detect many problems related with the body which can save many lives. Your expertise has shed light on the transformative potential of quantum technology in the biomedical field and their role in promoting sustainability. Once again, thank you so much, sir, on behalf of IBMR IPS Academy. Thank you so much.
I would like to thanks to AICT ATAL Academy for sponsoring this particular program, and I would like to thanks all the participants for their patience listening and be the active participant in this faculty development program. So as we are winding up this session of day 3, and we'll be going for lunch, and thereafter we'll be starting the next session from 2 o'clock. So thank you so much, everyone. Now I request everyone to kindly assemble outside for a group photograph with the resource person. Thank you.